comments, concerns while we're online, or if you guys have any questions for us, you guys can reach out to us privately. All of our DMs on all platforms are open, so DMs here on TikTok, DMs there on Instagram, they're all open. And again, Dr. Barlow's patient is having a brachioplasty, which is a arm lift. This patient is also getting lipo to the arms as well. So Dr. Barlow is getting started on some lipo first to the arms, and he's going to go in and do the lift. Again, what that looks like is making a very long incision from the elbow down close to the armpit. And where Dr. Barlow has already marked the skin that he's going to remove, that's where he will cut and make another incision to remove that extra skin, and then from there he will stitch this patient's arm right back up, and it's going to appear slimmer, thinner, and the skin around it is going to appear more tight.
That happy is not, or maybe it's this because it's hard to put. I thought I had that touch.
And again, we're showing this entire procedure, not the whole entire procedure, but bits and pieces of it on our YouTube there, Dr. Jeneby Plastic Surgery. We go live on Dr. Jeneby's YouTube platform. Collectively, Dr. Barlow, Dr. Jeneby, Dr. Cornelio, Dr. Phillips, they all go live on YouTube.
You're like this. I'm like, that's not just, that's not.
And again, with Dr. Barlow's patient, she's having an arm lift. And she's also having lipo done to her arm, so we're not just removing the skin, that excess saggy skin, usually due to a patient coming in after having lost a lot of weight, they will have that skin that is stretched to accommodate that extra fat. So instead of just removing that extra skin, Dr. Barlow is also removing some fat, so getting some lipo around the arms. He's just getting started on getting in there and making the first incision. We'll go ahead and kind of reposition and get a better view here in a moment. And again, we'll be live showing this procedure for a little while, so if y'all have any questions, leave those comments down below. Again, a brachioplasty, so that is an arm lift. All questions pertaining to surgery, plastic surgery specifically, we can answer for you.
Did you go off one of the CT2s? The 2Os?
No, I have
Or this one?
that one is the 9-1. And there
Oh,
was
yeah,
four.
okay, yeah.
Hey Majen, how are you doing today? Thanks for joining us. We're with Dr. Barlow. Dr. Barlow's case is a brachioplasty, so that's going to be an arm lift. This patient is having a brachioplasty and some lipo to the arms. I'm going to try to get a better angle here. with the arm lift, Dr. Barlow has to first make a very long incision, elbow to armpit. Amy Robinson here asks, where is he located? Dr. Barlow actually practices here out of San Antonio, Texas, and out of, I forget, Houston, Texas. So right now he is here in San Antonio. We're at Maximus Surgery Center, but he also operates there in Houston as well. And he basically travels here to San Antonio. Home base for him is Houston. If you click on our website that we have in our link tree, you can get more information on Dr. Barlow and where he is throughout the week. He's not here as often as as often as our other surgeons, but that's just because he operates at 2 different surgery centers. If y'all are interested in booking with Dr. Barlow, we have this form that's pinned here on the bottom. It's to get a quote form. Once you fill it out, someone from our team will reach out to you, and we are able to get you in contact with Dr. Barlow. So setting up a consultation with him, setting up either virtual or in person. If that's something that interests y'all, it's going to be pinned here on the bottom, or you can find it in our link tree.
He's eating somebody else's cake. He's eating birthday cake. And then he goes and steals somebody else's birthday cake. You look so cute though. What happened to you? You're so cute. With a big ass head. He does. That's like his meatball.
Really interesting and it piques your curiosity, y'all can join us on YouTube. We're showing the surgery there. Over there we flip the camera and we're able to show the procedure, the surgeon, and and the procedure that they're having done. So for example, when we're on YouTube, we're able to show bits and pieces on different angles of this brachioplasty that Dr. Barlow is this patient. It's just the brachioplasty and some lipo to the patient's arms. So it's pretty simple, it's pretty straightforward. It is pretty quick today. And arm lift actually takes a lot of precision just because that incision that's made on the arm is very long, and because of that it takes a lot longer to stitch it back together. happening right now is earlier Dr. Barlow, before surgery even happened, he marked her arm. So right where your arm rests against your side is where Dr. Barlow basically marked this patient's arm. So starting from the elbow going all the way down to the armpit, Dr. Barlow made a very long incision. So cutting through that skin, cutting it open basically.
We're gonna be there early. I might go with you. Might meet you up there. I said, I'm gonna have to go up there. I wanna go to Party Bar because I want like a Dutch oven, like a really good Dutch oven.
And so Dr. Barlow has already removed some of that extra skin and fat from the markings that they made earlier. And again, this is all on her right arm. And then Dr. Barlow will go in on her left arm and basically do the exact same thing over again. Usually a lot of patients that have gained a lot of weight and then lost a lot of weight will come in for an arm lift. So a lot of fat loss patients. And it's usually because after you lose a lot of weight, that skin is not the same anymore. It's been stretched. And so just because you've lost the fat doesn't mean that the skin can go back to its original state, go back to its original size because it's been stretched out. And also due to aging, the skin loses elasticity. And so due to that, sometimes you'll see in patients after they lose a lot of weight, especially if it's a lot of weight, they'll have a lot of loose extra skin that's just really saggy and undesirable in some areas. We also see a lot of people in for tummy tucks that have lost a lot of weight as well. Not just mamas, but people that are very overweight and then lost all of that weight come in to get tummy tucks. So, all that to say, I'm not sure if that was this patient's case, but if that speaks to you, it's something to consider. Hey Brenda, yeah, we're actually showing this procedure on our YouTube. If you want to join us over there, you can find it here in the link tree, or you can join us and look for us manually at Dr. Jeneby Plastic Surgery. We go live on that YouTube to show any surgeries. So let me know if that helps, or if you have any trouble finding it, you can find it on YouTube, on that platform. And we'll be live there for a little while. We'll be live for about 20 more minutes. Then we'll probably go in and take a break and then come back, but we'll be live there for a little while longer if you want to try to join us on it. again, it's going to be Dr. Jeneby Plastic Surgery. I can't link it here, like in the live. But let me know if that helps. Finding it manually, so just going and searching it on YouTube, or if you can get to it through our link tree.
Right? What's not the one? Wait, was that for me? I didn't know it went that high. We'll keep it a little secret. He swears they bought it from him. He hates us on the health part. And then Nicholas, when you like him too, with his instruments, like, these are mine. That's how he makes the instruments.
Again, we'll be live for a few more minutes, so if you guys want to ask any questions, please feel free to do so. And again, we have Dr. Barlow just on the other side of the table, so we can ask Dr. Barlow if there's a question, a specific question that you might have. Here with Dr. Barlow's first patient of the day. She's having a brachioplasty, so that's an arm lift. And she's also having some lipo done to her arms as well. So this part that hangs like right here. Dr. Barlow's going to go in and remove that excess skin. He's also doing lipo in that area, so that means removing fat. And that's how much fat we have right there. If you're on our YouTube, you guys can see how much fat Dr. Barlow is removing from this patient earlier. Dr. Barlow was on the patient's right side, so made that very long incision along this patient's right arm, from basically about the elbow down into the armpit.
Justin stuffing his face. And then he said he's gonna come in and let you stuff your face.
And if y'all have any questions, that's what we go on these live
Burgers are like a pasta salad. Like Mediterranean pasta salad.
That's what we go live for, just to give y'all an opportunity to ask any questions and to engage with us. So again, no question is a silly question. If y'all have any, please leave them here. Y'all can always private message us or comment on our video. We always try our best to get back to y'all as soon as possible. And we'll be live for about 5 more minutes. And then we're going to go ahead and take a break. However, we'll be back and probably show more of this procedure. This one will take a lot of time just because the arms, due to the length of the incision, how long the incision is, it does take a lot longer to stitch it back together. But we'll more than likely be back live after our break. But at about 30 minutes, we're going to go ahead and take a break. So again, if you have any questions, please leave it here on the line. Private message us or comment on one of our videos. We'd love to answer y'all's questions and get in contact with you. Again, we are live on YouTube, so you guys can join us over there as well. On YouTube, we're able to show more. We're able to show the OR. We're able to show the patient, our surgeon, the procedure. So it's going to show some blood, show some nudity. But if that's something that interests y'all, we're always going live there throughout the week. It's going to be at Dr. Jeneby Plastic Surgery, or you can find it on our link tree. And again, we'll be live for about 4 more minutes just to show y'all what happens in the OR, and then we're going to go ahead and take a break. But just to give those who are on our TikTok an idea of what's happening right now, Dr. Barlow is doing a brachioplasty, which is an arm lift. Earlier, he did some lipo to the arms. And so what a brachioplasty entails is removing that extra skin that tends to sag over time. So this patient, I'm not sure what her case is, if she's lost any weight. Usually we see arm lifts very common in older folks or patients that have undergone a lot of weight loss, and that extra skin just doesn't jump back to where it was before the weight gain. And so what we can do is make a very long incision from your elbow all the way to your armpit and cut out some of that extra fat, extra skin, and then from there stitch it all the way back up. Stitch it all the way back together. So that's basically what a brachioplasty entails. someone you know is ready to take the next steps in booking your surgery, you guys can join us on Dr. Jeneby plastic surgery to get an idea of what that looks like. But we also have this form that's pinned here on the bottom, and that's the first step that we have our patients take when it comes to getting in contact with us and moving forward and scheduling the consultation and scheduling the surgery. We just have them fill out that form, and it's a get a quote form, and from there we're able to basically determine what we need to figure out next in order to get you from here, from just these lives into the OR. Since that's something that you're interested in doing, it takes about 1 minute to fill it out. We would love to hear from you all. We would love to get in contact with you and answer any questions you may have about how we do things here with Dr. Barlow. And yeah, we just love to hear y'all's feedback, give y'all more information, give y'all some criticism, or hear y'all's feedback.